We are live.
Yay! Hi guys! Sorry for the delay. We were just fixing up our charcuterie board.
Which looks amazing.
Yes.
Thank you.
Check their phones for
Yeah, just want to make sure everybody's here. Sorry.
So this is a special Friday live for you guys. I know that we have a lot of prizes and stuff at the end too. So we're gonna be drawing some names. But meanwhile, we're gonna be asking or answering some of the questions that you guys have been asking us. And women's health is kind of the topic of the day. So.
Do we want to do introductions? So everybody knows Dr. A. Not sure if you don't, but this is our doctor.
Hey guys.
This is Bianca. She's our awesome medical assistant that sort of works hand in hand with our doctor.
Hi.
She's wonderful.
Nice to meet you.
And this is Cassie.
I'm Cassie.
Sometimes
sort of the voice behind. Sometimes you just hear me chatting away, but I'm the patient coordinator here, and I will hook you guys up with anything that you need here. And we're gonna just pour some wine and just relax. And if you guys have any questions, we're gonna sort of go over. We just discussed that this month is it's Women's Day on Monday, but we decided to sort of do a month celebration for women. So we're offering some awesome treatments, specials on the treatments that we have here geared specifically towards women. So we're gonna sort of focus on that. Which is Thermiva. We have our bioidentical hormone therapy program that we have.
And I think these are going to be some of the main topics that we're going to be talking about today.
Yeah.
We're going to be talking about Thermiva, which is like a radiofrequency treatment, and then we're going to be talking about
For which
bioidentical hormone replacement therapy. And so we can start with Thermiva. So
Wait, how about we get some wine going?
let's get some wine. Let's get started.
That's definitely.
Well, we can talk about any other topic, obviously, as well.
Indeed.
So
Do you guys
any
like
other
red or
questions you guys
Yes.
have?
White? White?
Oh,
Red?
okay,
Yeah.
forgot.
I don't discriminate when it
Discriminate?
comes to wine. Just
I'm gonna
pour.
do my best. Oh my gosh.
We'll keep talking.
So I don't know if there's any specific questions or anything to start with, but we are talking, obviously we cater here for both female and male patients. We do have a large portion of our clients are females, and we do many different treatments. One of the most common treatments, good job, I think. You got it about 1 minute. One of the most commonly done treatment is bioidentical hormone replacement therapy, and the two main hormones that we're talking about in this case are testosterone and estrogen. And actually, I should say 3 because progesterone as well. And a lot of times you think of testosterone as a kind of male hormone, estrogen and progesterone as the female hormones. But testosterone is also, found abundantly in females, and it does start to go down with age and presents with many different symptoms. So hormone replacement therapy is one of the services that helps a lot in that regard, and it's very popular actually among our clients, both males and females. But with that, we'll kind of get a little bit more into details, but basically, with time and with age, a lot of the hormones starts to go down in their levels, and with that comes a lot of different symptoms and sometimes medical concerns and medical issues. And one way to try to resolve a lot of these problems is by replacing and giving the body these hormones are going down with time and with age.
We actually have some questions. Cheers to Dee Dee. Thank you. We are cheersing to you. Sorry, I'm sort of watching on my phone as well. And we have a couple questions already. So somebody's asking, do you want some wine?
I'm okay for now.
Oh,
Thank you.
coffee, tea?
Yeah, I'll finish my tea. I have tea inside. So.
we have some questions. So, what treatments are most common before summertime? That's a good question. I guess.
Yeah, I mean, Botox and fillers are common year round, but before summertime, a lot of people try to, everybody's trying to get ready for the summer, so that's a very common treatment. A lot of people kind of getting out of that winter like to do some vitamins too, whether it's B12 vitamins or IV vitamin therapy, just to kind of get some of that energy, because a lot of people start to get active around that time. So we kind of definitely see kind of an increase in that stuff too, the IV therapy, the vitamin shots.
Great.
We do a lot of weight counseling and things like that, so everybody's trying to get beach body ready and stuff.
Snatch that.
Okay. At what age should you start to think about hormone therapy? Good questions.
Yeah, and it really depends. So at what age should you start? It really depends and it really varies. Some people, most of the clients start doing it around the time of menopause, because that's where they start to see a lot of the changes, and that's where there's a big decline in the production of estrogen. So most of my clients say that time is not really fun. No, I'm just saying in general.
Looking at me.
I can't speak from personal experience. So.
I will be 49 in a couple of weeks. We know that my hormones are changing. My poor doctor reminds me on a daily how emotional I am. No, kidding. But we are in the process of testing all of my hormones to see where I land as far as hormone replacement therapy. Unfortunately, I don't know that I'm truly a candidate because of certain cancers that were in my family that were estrogen based. So I don't know that I can actually do pellets, but we will look into alternatives for me, which doctor can do. If you're not a candidate for the hormone replacement, we definitely can do some research and figure out what we can do to help you. That's where his expertise comes in.
That's sort of a good thing too. Like, not everybody can qualify for this.
Exactly. This isn't like a shotgun approach where we just give hormones to people randomly. We have to we get labs. Obviously, we check each person and we look at each person individually. What's their history? What's their family's history? What kind of symptoms are they experiencing? And we kind of tailor our treatment based on that. That is a medical treatment. This isn't so we have to get everything in line. But a lot of people, kind of back to the question, around that time is definitely where most people get it. But there's a lot of people who start a lot earlier, in the 40s, sometimes even in the 30s. With pregnancies and things like that, the hormone levels can change. Whether people are still planning on having kids or they're done with having kids. There's a lot of different factors. So most commonly it's in the late 40s, early 50s, but depending on each person, it can be even a bit earlier. Doesn't mean that they're going to be a great candidate a bit earlier, but they're definitely, they come in and we talk about it, and sometimes they're a great candidate and we do it, and sometimes they're not, or we have to wait.
Awesome. So we have, what's the best subtle lip filler for a senior?
So there's a couple lip fillers I do like. You do have a few options when it comes to lip fillers, but if you want something subtle, then you want to go with something soft. So there's many different fillers on the market, but they each have slightly different properties. Some of them are going to be more volume, some of them are going to be more lumpy and not great for lips. But there are a couple different ones that are very subtle. So from the Juvederm family, Volbella is the softest one. From the Restylane family of filler, Restylane Silk is soft, but also Restylane Refine is really soft. And then there's Bolatero. So any of these three options, they're going to give you soft results and they're going to be subtle. But I would definitely start with one of these, like Volbella, Refine, or Bolatero if you want something really subtle.
Great. I wanted to ask, I know you touched on pregnant women and hormone therapy, and we do have a lot of moms that call in that are either still nursing or do intend to have more children. Nursing moms, can they still do fillers and Botox and do some of the treatments that we do, or do we recommend that they don't? How does that
It depends. For a lot of treatments, we're gonna recommend that they wait until they're done with nursing. You know, there are a few things that are still safe, but mainly it's gonna be like certain vitamins, and or you know, like sometimes people just want to do facials or things like that, and that's fine. But if you're doing anything with Botox or fillers, usually we try to stay away. If you're pregnant or if you're nursing, we usually wait.
Okay.
So I guess I see everybody's questions, so just give me a second. Still touching base on hormone therapy, somebody asks, does hormone therapy help with irregular ovulation?
That it can, but that's a little bit different than what we're talking about. So sometimes with irregular ovulation, it could be that person's having issues with hormone and they need hormone regulation. So that is possible, which can be done through medications, and you know, that's a great thing to talk you know, to us or to the gynecologist about. So you know, that's, and because you know, hormones are part of, they're with us throughout our whole life, and initially with ovulation, that's all due to the hormonal cycle, and if there are irregularities over there, it can be regulated, but that's not necessarily replacing hormones. What we're focusing on here and what we're talking about here is the decline that comes with hormonal level, that comes with time, and how we replace it because of the symptoms that kind of occur with that. And maybe it would be a good idea right now to talk about some of these symptoms that are common, and these are again related to both testosterone and estrogen. And so with time, testosterone levels start to decline, you know, in the 20s, 30s, 40s. Estrogen level, kind of the estrogen goes in cycle, but then once you hit the perimenopausal level and the menopausal level, and the kind of the ovaries start to shut down, the estrogen levels decline as well. So when your testosterone levels are down, when the estrogen levels are down, there can be many symptoms that would present coming along with that. Things like energy going down, lack of energy, fatigue, but things also like mental fog, headaches, joint pain, weight gain, inability to put on muscles, insomnia. It's just so many different symptoms can present from that stuff. So, and that's why, and that's kind of what we're talking about. When your hormone levels are down, a lot of the body functions that are regulated and affected by hormones start to get affected, and that's why you can get all of these symptoms. So, and kind of part of what we do here is we start with you know, taking the history of the patient and figuring out what symptoms they're having and if they are related to hormones. But then we also pair that with getting the levels, the lab levels of the hormones and other things that can cause similar symptoms, whether it's the thyroid or other stuff, or even certain vitamin levels. And you know, if you see that clients having all these symptoms that are related to a decrease in their hormones and their hormone levels are down, we can, you know, see that if we are able to replace some of that lost hormones, we can alleviate a lot of these symptoms that they're suffering from.
Great. So speaking of vitamins, there's a couple B12 questions. How fast is the vitamin B12 shot you inject or you take? How fast does it take to inject? Yeah. But that's something, I don't know, we can answer because Bianca, I mean.
Oh, it's just a couple seconds just to inject it. I mean, the whole process is probably, you know, about less than 5 minutes for us to draw the medication up, clean the area, and do the injection. The injection itself is just a couple seconds. It's not long. If you're just doing B12, we can do an intermuscular injection either in the arm or the glute. You kind of switch off every time you come in to get that injection, and you can come in how often?
And it depends on that person's diet. Again, a lot of these things I hate to keep saying it depends on people, but it really does. Many people, you know, depending on where their levels are, might do it like once a week initially and then kind of spread it out more often. But we can also look at the type of diet you're getting. Are you getting, like, how much B12 you're getting through from the diet? If you're not getting enough at all, you might need to do it kind of more frequently, every couple of weeks for a while. If it's not as much of an issue for you. You might be able to just kind of want to do it once a month or every couple months. So there is a little bit of variation, but it's safe for people to do once a week, you know, in some cases, and you know, sometimes we spread it out more often and it's still very safe. Vitamin B12 is a very safe vitamin, which is one of the good things about it. So yeah, the initial visit is usually, if you're doing a series, is what takes a little bit longer because there's some paperwork and kind of like a quick consultation. But after that, if you're just kind of coming in for your follow-up shot, it's a lot quicker because you just kind of come in.
Yeah.
If nothing has
And that's,
changed.
right, that's something, I mean, we're all sort of, all of our staff here, we are all certified medical assistants, so don't be alarmed if, just because I'm pricing you and then I take you back to get a shot doesn't mean that I'm not qualified for it, but we are all here. That's one of the great, you know, I love working here because of that, so we all sort of know the ins and outs of all the treatments and services that we offer here, so we sort of try not to skip a beat. Bianca's just wonderful because she works hand in hand with Doc, and she's great. So,
Thank you.
especially for, I mean, I don't know if you guys want to touch a little bit more on like Thermiva. Just, I know that that's something that's sort of hard, I feel like, sometimes to talk about for women, and don't be alarmed just because our doctor's a male. Bianca's here to help with that procedure as well. So, and she's wonderful. So,
Yes, we can talk a little bit more about Thermiva.
Thermiva? Yeah.
It's definitely, again, one of these treatments that's gaining more and more attention right now, and people are asking about it more and more often. It's a radiofrequency treatment, and it helps simulate the collagen sometimes too. So there's two main reasons that we're seeing people coming in and asking about Thermiva. One of them is kind of has to do with urinary leakage and SUI, which basically means it's a very common problem actually. Not a lot of people talk about it, but it's very common. But
Anytime any of us women have children, when you
Yeah.
sneeze, cough, laugh, run, jump, you're gonna pee a little. It's just a common thing. It happens.
yes,
So
and we're
that's-
all moms
that's
here
reality.
too. So
Yes.
it's like we all we totally, completely can vouch for that whole symptom as well. So
I think I just peed a little mad.
no, yeah. I'm not a mom, but she's like, you're all moms.
we're all moms here. We're all moms
Except for
here.
me.
Moms here.
But yeah, that's one of the main reasons, because it can really help with that. It's usually a series of multiple treatments, and some people just do it for kind of like vaginal rejuvenation too. Again, with and a lot of times it actually goes hand in hand with hormones. So a lot of times, whether it's things like vaginal dryness or just decreased sexual function in general, it might be part of it can be addressed by hormonal treatments, but sometimes a treatment like Thermiva is very actually good to have as well to complement that, and because it's going to have its own additional benefits. And maybe we'll just kind of explain a little bit about the treatment itself and how it goes, so that people are kind of know a little bit more what we're talking about. But it's basically a treatment that we do here that doesn't take too long. It takes about 20 minutes. It's not painful, and it's a probe that we insert in the vaginal canal, and it just produces radiofrequency, and it helps simulate the area. There's really not much downtime with it. It's not painful, and like I said, it's getting much more common nowadays. We do recommend series of few treatments, like maybe 3 or 4 treatments initially for the best results. But a lot of people, even from the first treatment, they start seeing improvement. But it's one of the things, like honestly many treatments, where to really kind of get the best results, you might need a few treatments initially, and then after that, it could be like once a year or once every 15 months, where you do one maintenance treatment.
I am in the room with the doctor. He's not in there by himself, so I am in there to assist him to keep our patients comfortable and relaxed during the treatment. The treatment lasts, did we say this, maybe?
Like 15-20 minutes?
15-20 minutes, yep. And it's super fast, super easy, maybe a little awkward and uncomfortable, but it's really worth it. And
Yeah.
I would
Patients are
recommend.
very happy with it.
Yeah, patients are very happy with it. They are seeing results, and call us to inquire about it more, and we'll get you scheduled.
Yeah, if you guys are worried about pricing, then just it's best if you just call our office and we'll.
Ask for Cassie.
Yeah, I will help you with pricing, Mother. That was my mom asked that question. So. But yes, please call if anybody has any questions about pricing. I am more than happy to have a discussion with you about it. And like I said, we sort of recommend you coming in and meeting with our doctor and Bianca, all of our staff here. Just that's sort of the goal I think here with us is like we really want to be here to help you guys. So come in, meet us, hang out with us. We offer these awesome alternative forms of treatments, and just it's well worth coming in and just sort of establishing a relationship with us, because we just want to help you out as much too. I think that there's some other questions. I think it's like filler related. Let me just go back real quick. Sorry guys.
With the Thermiva, there isn't really a lot of contraindications. The main thing, since you're talking about it, is that you can't. We don't want you if you have. You don't want to do it if you have an IUD at the same time, or usually we don't do it if there's any metal in the body. So if you've had like a hip replacement surgery and there's any kind of titanium or metal there, these might be a couple of contraindications. But honestly, most and as Bianca said, it's a common problem after pregnancy, especially. So. Most people, end up being great candidates for it.
Somebody's asking about, is it common for a body to reject filler products? Somebody involved, I think it was Juvederm, she had said.
Yeah. I wouldn't say it's common, but it definitely can happen. And it's not usually rejection, but sometimes with certain fillers, the body can form a nodule around it. A lot of times too, if the filler is just kind of placed too superficially or not in the right layer of the skin, the filler itself can be foul and it can be firm. But in few cases, again, not common at all, but in few cases, the body can kind of form like nodule around an old filler. Again, it's not common, but the good thing about these fillers, especially if you use something like Juvederm, as you might have mentioned, or even Restylane, or Volatil, which are the three that we've already mentioned, they're all dissolvable. So if that does happen, you can put some Hylenex in there or something to help dissolve the filler, and that usually takes care of the problem. But
is it something that our body metabolizes it faster? Did you just say that, or is it like certain people handle it?
Yeah, well, people do metabolize fillers at different rates. So there is that thing where some people, they might get filler, like let's say down in the under eye area, and it might last them a year. Someone else, it might last 9 months. Another person, it might last a year and a half. So there's definitely some difference in there. So that's part of it. But some fillers, again, not common at all, but the body can form some nodules on it. That's what the client was asking. In that case, if there's any issues with any of these fillers, then dissolving them is usually pretty quick and usually solves the problem. So.
Okay, let's see. It was dissolved but painful.
Yeah,
So can it be painful?
The dissolving process itself can be a little bit like painful, meaning when we put in the treatment, shouldn't really be painful much afterward. It can be a little bit from just soreness or bruising, but just like when you get fillers injected, it's a needle, so most people don't like needles, so it's a little bit sensitive. But so that it's not the most comfortable thing, but most people do tolerate it well, and we do numb the area usually, if when needed, which helps.
Sure. We're gonna just do, I think, a couple more questions, and then to touch base on the giveaways, guys. So what we decided to do is we'll do a winner, and then we'll post it on our story. We'll draw it at the end and post it on our story. But tune in all month, so you have to dedicate to us, because we're gonna be giving away some stuff every live. So not necessarily this live, but we want you guys to just hang out with us and just, we want to offer this to you if you do, end up being here with us. So just to touch base on that. But I think a couple questions about, somebody said that they highly recommend us, and the doctor and staff are amazing. So look at us.
Thank you.
Yeah, thank you. We appreciate that. So.
That is nice.
And then somebody's sort of asking if you don't have the symptoms of anything that you're experiencing, I guess, do you need Thermiva? Like, is it something that you, I guess, what I'm interpreting from this is like, do you need to be proactive about this, or is it just if you experience the symptoms?
No, you can be a little bit proactive about it. So it doesn't. It's definitely something that's not gonna, like, it doesn't hurt, and just like with face treatments, you can get certain treatments to reverse certain issues, and there's certain treatments that can be done to help prevent. With Thermiva, kind of, if you are having any issues, the earlier you start, the better, because kind of the less severe it is, the kind of easier it is to treat. It doesn't mean that if it's more severe, you can't do the treatment. You might need a few more kind of sessions to kind of get to the result you want. And the same thing, if you're kind of worried, or you're worried that you might start to lose some of that collagen and you want it to be a little bit more proactive, you definitely can. I would kind of actually recommend that.
Yeah.
And it helps. Did we mention vaginal dryness too? Does it help with vaginal dryness?
It definitely can.
And what about like externally? It kind of tightens everything up externally as well. So I know, right, in time, gravity kind of takes over. So I think this helps with tightening. And then, can I ask the uncomfortable question? Does it help, like, tighten things up for?
Many people do report that we've actually had a couple.
Many people.
Many people.
No, we've had a couple of husbands who came in.
I
And
mean,
were,
they
we
say
have a
their
female
wives.
who's like, we have a guy who's like paid like 4 treatments for his wife.
Love it.
So maybe not for
Yeah.
after pregnancy, but before pregnancy. If you feel like you need to tighten things up inside and out,
Oh
this
my
may be a
gosh.
good treatment as well.
That's so funny. Oh man, that's
You
so
know,
funny.
the
You're
females
welcome.
are usually happy, but sometimes the husband and stuff are also happy. We get,
Sometimes, yeah. I don't know. I mean, maybe just touch. I mean, we could do a couple more minutes. I don't know if you want to just touch a little bit on, like, sort of, being proactive, maybe just on all of our treatments. I know with, with Botox fillers and all the things that we offer, it's like, it's sort of a preventative style lifestyle. So I guess maybe
it definitely can, for sure. It definitely can be, and just like anything else, kind of what we're talking about. When you start earlier, a lot of times people wait if, whether it's something like we were talking about with the Thermiva, or whether it's something in the face, like they start having a little line and they're like, oh, it's kind of bothering me, but I'm gonna wait until like I can live with it for now.
Yeah.
And then it gets worse, and they're like, I'm gonna wait until it's really bad, and then all of a sudden they can't take it anymore. They come in, and we still do what we can to smoothen that line, but obviously the sooner you start, the easier it is to correct, and the more kind of room we have to do more proactive stuff and things that are more preventative in that regard too. So Botox is great to prevent. Botox works on the muscle. I keep telling the clients that, and not on the skin. So people come in because they see wrinkles in the skin, and that's what we see. But once the wrinkles are kind of like deep in the skin is like paper. It becomes much harder to like unfold and treat. But if we kind of take care of the muscle first before it causes, the deep wrinkles in the skin, it's gonna prevent it from happening in the first place. So Botox is definitely one of my favorite kind of preventative or proactive treatments, if you will. But fillers can be too. We lose volume in our face with time, and the volume kind of starts to go down with gravity, and it happens to all of us, and it starts at a very young age. Now, a lot of times we kind of hit a threshold because we've lost so much volume that now like it really bothers us, but it's been happening over a long time, and now you have to put so much more volume to try to correct what you've been losing over 20 or 30 years, as opposed to if you just kind of came in and did a little bit each year, just to kind of help reverse each each little bit that you lost as it was happening, as opposed to kind of waiting for everything. So yes, filler. A lot of people now know that Botox can be preventative, but even fillers, as you're kind of saying, can definitely be preventative or proactive. Again, by being more, and that's how you do it more, kind of get more subtle results each time, because you're not trying to fix, 30 years or in one treatment, where you have to kind of be a little bit more aggressive. But if you're doing it proactively every 6 months, every 9 months, every year, depending on where we're starting, you can be a lot more subtle with each treatment.
Sure. All right, one more question. I know Alicia she just came in the other day and she said that our PRP microneedling is amazing. So that's another treatment that we offer here that can also just be one of those like preventative, right? Mm-hmm. Fine lines, wrinkles type of thing. And then I guess last question is, what is the best treatment for fine lines under your eyes?
Depending on the person, might be Botox or fillers, might be even something like plasma pan or PRP. So everybody's a little bit different. If it's dynamic wrinkles, meaning when you smile you see some wrinkles, but they're not there at rest, and Botox might be a good treatment for that. If when you're talking about the line, you're talking about kind of the deeper creases that we sometimes see due to loss of volume, then fillers is a great correction for that. But sometimes if you're just trying to make the skin a little bit more firm, then you might want to do something like a plasma pan, or even something like microneedling with PRP, with your own blood and the platelet-rich plasma.
What about aqua gold? Because I know that we offer that as well.
Yes.
Is that something that?
Yes, and aqua gold can actually be a great treatment for that too. And aqua gold is a good mixture of micro Botox and fillers and microneedling, so it's great in that regard too, because you get kind of a little bit of different treatments. But that's a great thing about it too, if you come in, is that it's not just one option. Again, we're not trying to do one size fits all. We look at the patient, we look at the client, and kind of we decide based on that client. But all of these, would be great options for the right client. Botox might be the right option for one person, but it might not do anything for a different person, because that other person might need filler or something else.
Okay, so I think that's it. Thank you guys. Like I said, our staff here, you'll meet the rest of the staff next Friday. Everybody's a little camera shy, so I'm going to force them to come on. So you got to meet us three, so we'll have a couple more next week for you. But like I said, we're going to draw the winner. We'll post it on our story, so we'll reach out to you. And thanks so much for joining us. So we'll see you guys next week. Yeah. Have a good weekend. Happy Women's Month. Come in and see us.